think of that idea? How
I think that probably it's difficult because of the HIPAA standards, and even with, it's not that they don't want to take people, it's that, to answer, well, he's leaving. Hi!
His mom works in the field.
To take his question, a lot of contracts, even aside of doing coding all the time, you can do short-term contracts and things like that, but we have to get, we have to take tests, we have to get security clearance, all of those things, and I think that's why it's been difficult to give a live environment type opportunity to students that are in the industry. All that we're able to do is really kind of, I'm just saying our classes that we teach, we actually have some agreements with some like encoder products and things like that where folks can train. This is a problem with medical assistants. This is not just a problem with coders. This is a problem with everybody. But again,
I get to be the guinea pig.
Yeah, it's really, really hard because again, the hospitals are not going to, just take people temporarily. That's what's difficult, and allow you. We have access through the cloud, but we have to get cleared through their IT departments and stuff like that. So, I mean, I know we teach those programs because we have access to them, but we have arrangements with people from those groups where we can show them kind of a live type environment. But we couldn't drag into facilities, not our contracts that we have. And we work all over the country as well, so I think that's what the difficulty is. It's just, and HIPAA's much stricter since ACA and things like that, much stricter. So that's the difficulty, I think.
And the same with the VA. I mean, you have to have your background check done. You have to. It literally almost takes an act of Congress now to get things pushed through IT. Even for those coders in the back there, that Wanda, who works from home, God bless her. Even for my routine people, every 6 months IT's at them, or they've locked them out of their computer, or they have to go through the whole process again, and it sounds like it's a lot of double work, which sometimes it is, but until the IT people kind of come up with another way or an easier process, we won't let you have anything to do with a virtual internship. That would happen.
We would be able to do it, but Precise also has, we have our own education platform. So we had 3 million learners in Precise University get ready for ICD-10 internationally. So we have education material and we have simulators, practice charts for you to go through. It's not real. The way that we've been able to accomplish the practicum is with redacted records or records without PHI in them. So you're still able to go through the records and code them. We actually have all Precise, we'll outsource the entire HIM department. So like a hospital, for example, Naples will say, run our whole HIM department. And Precise comes in there and runs the HIM department and charges the hospital a fixed cost. So what we've been able to do is say, we'll put apprentices and people in their practicum at Naples, but Precise, again, owns that HIM function. So that's 2 different ways that we've been able to do it. From a simulation perspective, leveraging Precise U, and from an applied apprenticeship or practicum, leveraging one of the 100 hospitals where we're the full outsource. Where we are intern, just providing extra coders to a hospital, we run into those same challenges where we have to work with IT and compliance and others, and even our own technology to make sure that you have the right access at the right time. But those are 2 things that are a little bit unique to Precise, where we're able to afford those opportunities.
I think simulation is important because there's a lot of online capabilities to be able to do that through a number of different educational and organizational areas. I have to tell you that we're talking right now to AARP because they're having the same problem. They're doing their Plus 50 program and they're putting people through their classes, and people won't hire them because they're saying you don't know our system or this, that, and the other. But that's why it's so important for you to try as you're in classes to get some type of volunteer work. Because for you to be able to say, I have worked somewhere, because guess what? No matter where you go, you're going to learn a new system. I think that's, if you're not willing to learn a new system, everybody uses different systems.
Yep.
So.
And we go through like 5 EHRs and we go through 2 encoders.
Yeah.
So they get a lot of technical hands-on that a lot of other colleges don't have.
Right.
So we're very
And
happy.
even though you
for
might
that.
know a system or you think you know it, each company or each facility throws in their own bells and whistles and makes up, turns this one on or that one off. And so it's not the same everywhere you go, but it's similar enough that you can usually pick it up.
Right. It's kind of like Yahoo versus Outlook. That's what I say.
Yeah.
They all work the same. You just got to do the bells and whistles and understand what's unique.
Last time I was here, and then I'll zip it. I said this when I was here a few years ago, and I think it's important to say because a few people approached me afterwards that were students. When you become credentialed, you also adhere to a code of conduct or a code of ethics. And I'm sure that's woven into your classes in a lot of different ways. Some is through mandated ethical compliance, which our peers refer to HIPAA and some OIG compliance, etc. But really knowing what the code of ethics behind the credentials that you're getting are, and to really take those seriously. As an HIM professional, you're going to be questioned on the decisions that you make and the changes that you make, even if you're touching a record, you're touching a patient, you're touching data, and to really take that code of ethics seriously and to use it as something to fall back on. Because you can find strength in not just your credential, but also the morale that both associations have taken time to put behind what they deem ethically appropriate for what you do every day.
Can I throw one more opportunity out there? I'm sorry, I was
Sure,
going to do
go
this.
ahead.
There's something called, and you all might want to look at it from a coding perspective, called HCC coding. It's very new. It's hierarchical condition coding, and basically it's based on the diagnosis code. ICD-10 has changed that drastically as well, but it is a different form of coding, and I have to tell you that if you were looking to get into anything that is brand new to everybody in the industry, there are companies all over the United States that's all they do.
And
is HCC.
we actually have a local, Metcare is right here locally. One of my students is actually the lead, and he hires people to do HCC coding. That's what they do. We have about 3 or 4 graduates that are that do the HCC.
They're remote coding jobs, so they don't, they hire everybody all over the country. The company that we work with, HCC, hierarchical coding conditions.
You're coding for the insurance company to collect, basically, so for instance, there's a Medicare Advantage program. So the insurance companies get reimbursed by Medicare to provide those services to the patient. They need to prove their care with coding. So they have to code actually for the insurance company to Medicare, Medicaid.
Not
It's
billing.
teacher coding.
Not billing.
It's
right?
like,
It's not billing,
it's
but
not a
it's
billing,
doing
right.
some
Coding for
quality.
medical record documentation,
In the VA, it's called VERA, Veterans Equitable Resource Allocation.
which they've had a lot longer than we've had.
Absolutely,
That's exactly
and
right.
it's very important.
I'm a sister of the director at WellMed in Dallas, but she texted me on Sunday. It said, our membership will triple by the end of July, so get yourself some HCC experience and get over here.
There you go.
Yeah.
Great
All over
opportunity.
the country, so.
And if you get in on the ground floor, it's almost only about a year or 2 years old.
And we went to 3 conventions this summer.
The convention queens.
Yes. And every one of them had HCC presentations.
Yes.
And can I also say that not just coding, I work for a company in New York that actually I do HCC, and I only did it just because I wanted to learn it because we had heard so much about it. But they also have auditors that are not required to be certified coders. They're required to be certified auditors, which I find very odd, but that's just the way it is. So their coders are certified coders, but their auditors are certified auditors that audit the coders' work after the fact. and they're still working in I-9 because they go
Right.
back a year or 2 years. It's
The racks
basically
are all about
managed.
2 years behind.
Yeah, it's basically managed care. That's what it is. But with ICD-10 being new, there's a lot of people that think that that's going to become the new coding or reimbursement system for the physician side and the fee for service is HCC. Like we have DRGs in the inpatient and APGs on the outpatient, but it's all coding generated.
All right, so you've been here a while. We can keep talking all night because we love this stuff. And, so I would like to thank our panelists all for great turnout. Thank you for spending your time here with us this evening, and hopefully you learned a lot and you got a better perspective on opportunities and what you want to do. And please, you know, there's information down in the snack area. So we were down there, you know, and network with each other, network with our panelists, and I hope you enjoyed this evening.